Welcome to the Next Level podcast. Today we're here with Dr. Alyssa. I'm Dr. Kwan, and today we're going to talk about uh, the pelvic floor, people that are getting to be starting to exercise, and how the pelvic floor and exercise kind of tie in together.
Yeah. Hi, everyone.
So Dr. Alyssa's new with Next Level, but one of her areas of interest is pelvic floor, and you're a runner, correct?
Yes. Yeah, I am. Right now, I'm running like 5 to 6 miles 2 times a week or so. But now that the weather's getting nicer, hoping to get out a little bit more.
Yeah, I'm so ready for the weather to get
Yeah,
nicer to be
definitely.
able to start to exercise a little bit outside. Yeah, I mean, I think the thing that we kind of want to talk about today is uh, now that we're kind of climbing out of our COVID caves and people are trying to get better and be more active, um, and some people might have had kids during the pandemic. Uh, you know, some people might be having some issues that they didn't know were issues until they started exercising. In relation to the pelvic floor, like what are some of those things that people might be running into?
Yeah. So, specifically with the pelvic floor, we could be experiencing some urinary incontinence. So, what that means is some leakage of your urine during activities or simply just while you're walking or during like taking care of your children, certain things like that. I would say that's like the main symptom that we hear a lot about.
Yeah.
And Dr. Dave and I were talking earlier. It's also something that seems pretty normal that people have kind of normalized, but it's a misconception. It's just kind of one of those things that it's more common than it is normal. So we want to try and take that back and normalize that it's not normal to have these symptoms.
Yeah. Like what one of my colleagues, Dr. Pam, once said, and often would say, is that urinary incontinence is very common,
Yeah.
but it's not normal, and
Right.
it's never normal. Even though people in our lives, maybe our moms or our spouses or whoever
Yeah.
said that it is a normal thing. It's not a normal thing. It's definitely a sign that there's something going on in the pelvic floor.
Yes. Yeah, I would say that I think that's part of why it has become normalized is that so many years that it's been like we've been told, we've been grown up, oh, that happens after you have kids, like it's common, like, but no, in reality, it's not.
And a lot of times, I mean, like I've had a lot of patients that are CrossFitters and people that maybe haven't lifted weights before in their life, and then now that they are trying to exercise more, there's some better understanding about how the benefits of weightlifting, um, that they might be experiencing some incontinence or issues with their pelvic floor that they didn't experience because they never actually kind of reached that threshold, right?
Right. Yeah.
And we talk about like pressure management.
Hmm.
When you're trying to lift something very heavy, you need to actually have very good control of pressure in your body. And that's where it might actually kind of come out. No pun intended.
No. Yeah. I hear you. I think you bring up a great point, though, and that's where we can kind of think of this area of our body as a big pressure system. So it works with our breathing, and if we do add weight or running per se, it also adds stress. And if we don't have a good functioning system here, then that's where we're going to have some dysfunction.
Mhm.
And like you're saying, if someone adds weight or increases their activity, let's say they add miles on their run, and then all of a sudden they are experiencing symptoms, then the reason is they may be having some issues with their pelvic floor, that it's not dynamically moving with your breath and moving with the force, essentially.
So
So
I mean, um, if you maybe go into, maybe we could talk about like what the pelvic floor is. So maybe some of you guys don't even know what the pelvic floor is. Dr. Alyssa could, elaborate a little bit.
Yeah. So we have our lovely pelvic model right here. And if we look inside, so right now this sits down here in all of us, male or female. And essentially we have a sling of muscles that are attached all around our pelvis. And like I was discussing before, it works in a system where we have our diaphragm up here and it just you want it to work dynamically. And essentially, all of these muscles they help with support down here and holding in our bowels and bladder, and then also it plays a big role in sexual function as well. So I think those are the key main benefits of having a strong and healthy pelvic floor to help with all of those things.
Yeah,
Um,
it's kind of like the bottom of the bowl,
yeah,
right? If you
yeah,
have a bowl of
totally.
cereal and you don't have a bottom, it's kind of a problem,
Yeah.
right? So
Yeah, yeah.
it's basically holding all of our sex organs, holding our intestines, holding our bladder,
Yep.
and kind of forms the base of that cylinder that we're talking about, right?
Yes, exactly.
Kind of, the around the cylinder are your abdominal walls, and then in
Mhm.
the back is your back muscles, and around here is kind of like your core muscles and your obliques, and the top you have your diaphragm,
Yep.
and that kind of forms the cylinder that we're talking about. And the pelvic floor is super important, not only just for continence and sexual function, but it's extremely important in actually any sort of physical activity you're doing. And when we're talking about the cylinder and being able to manage your pressure and manage your ability to move your body and not feel like you're going to fall apart, and that's something I hear all the time with people that have pelvic floor issues. They just feel like their guts are going to fall out.
Mm.
And even people that have lower level pelvic floor issues, they just feel this like chronic instability, like their whole like they can't control their trunk, like they feel like their abs are weak. And the reason why that is like they're not able to maintain pressure down at the bottom of their pelvis.
Mhm.
So all the other muscles that are forming the other parts of that cylinder are either overworking or underworking.
Right.
So I mean, like the pelvic floor is so foundational for
Yeah,
any physical activity. It's not just about
totally. And I
being able
think,
to hold in your pee.
yeah,
Mhm.
absolutely. And I think that's exactly what you bring up great points of everything that we do. We are, like I said, if we're not getting that dynamic movement with our diaphragm and the pelvic floor, then how are we moving around?
Yeah.
We need to breathe, and that's fundamental. So it's not just necessarily while we're, like I said, running, lifting weights. It's also like doing things around the house, maintaining your daily lives and everything.
Mhm.
It's 100% a part of everyone's lives.
Yeah. And you could have a weak pelvic floor, but it's weak because you're constantly contracting it, right? So a lot of times people feel like, oh, I just need to do Kegels and I just need to, contract my pelvic floor. Um, when it comes down to like, actually, you need to relax your pelvic floor. Like
Right.
you
Yeah.
are doing too much, and you constantly feeling like you have to contract your pelvic floor to hold in your pee is actually a sign that there's something that we need to be addressed.
Yeah, definitely. I think that's you touch on a big point too, is that a lot of people think, oh, I need to do Kegels because, oh, I must be weak. Like, why am I leaking pee right now? Like, that's not normal. So I must have to be doing Kegels. And a lot of times, like you said, it's not necessarily that you have a weak pelvic floor, but necessarily you may be contracting too much and holding on. And then if you're holding on too much, you're not getting that mobility that we need to just be moving around.
Mhm.
And again, so if we think about it simply, the way our diaphragm works is when we take a breath, our pelvic floor should relax. So diaphragm goes down, pelvic floor doesn't move as much as the diaphragm does, but if we kind of look at it's like this. So it goes down, and then when we take a exhale, we breathe out, we should get the opposite. We should get moving up. And then that should be it. It's a contraction of all of these muscles working to hold it in.
in
So
tandem.
if you don't have that like combined co-contraction of those two muscles working dynamically,
Mhm.
then it could just be simply that your breathing is off from not having that,
Mhm.
so
Yeah, I mean, it's like if you gave somebody a 50-pound dumbbell to hold for 5 minutes, they could do it probably. If you gave someone a 50-pound dumbbell to do for 24 hours, they probably wouldn't be able to do it, right? So if you are contracting your pelvic floor all day, chances are at some point it's going to give out,
right.
right?
Yeah.
So I mean, that's the kind of analogy I use a lot for people that are overutilizing muscles, and your
Mhm.
diaphragm, your pelvic floor is a big muscle. It's a
Yeah.
pretty important one,
Yeah.
and one that's in the same way susceptible to overwork and fatigue. Um, and I also have the same issue with patients that feel like they have really tight muscles, and a lot of times the problem is that their muscles aren't necessarily tight. Their muscles are poorly positioned in order to do whatever job you gave it to do.
Yeah.
Right.
Mhm.
Specifically, like people always complain, like, I feel like my hamstrings are so tight. I feel like
Mm.
I have to stretch them all the time, but they never get loose. And that's an example of a muscle that might be poorly positioned, that makes it feel tight, that makes it weak. But stretching it is actually like the worst thing you could do. Same thing with the pelvic floor, right? You could have
Absolutely.
a poorly positioned pelvic floor and you ask it to do the job of what it's supposed to do, and it can't do it because the position is just poor.
Yeah, right. Or the other thing is too, if you're over contracting and getting other muscles around that are surrounding the pelvic floor and not necessarily getting the correct contraction of your pelvic floor. So that's the other thing too, which we find this is all things that we see in every other muscle, like Dave is explaining the hamstring. So it's all the same concepts. It just I think again it's less talked about and less normalized
Yeah.
to say like, oh, you have a ton of muscles down here that we need to address
Mhm.
because these need to be working dynamically and even more so than your hamstrings with every breath that you take. So,
So, what are some signs or symptoms that people might have when they have a pelvic floor issue that's kind of creeping up, but they just don't know it yet?
got it. I would say any pain in any of this area, basically. And I, like we mentioned already, like any leakage of urine or any leakage of bowels, that all is working through your pelvic floor. And some other things could be the amount of times that you urinate or expel your bowels is another sign. If you're doing that multiple times a day, or like I kind of mentioned earlier, if you're kind of going to the bathroom and then in a short span of time feeling like, oh, I have to go again, or even like going to the bathroom and then feeling right away I have to go. So like you may not be fully emptying, and in that case like we mentioned, you may be overly contracted and you're not able to fully relax. So those are the type of things, you know, that you're feeling like you're not fully like maybe you don't know recognize that feeling that you're not fully emptying,
Mhm.
but those are the signs to say like if I just went to the bathroom, then I'm like, "Oh my gosh, why do I have to go? I just went."
Yeah.
So that is a sign telling your body telling you that you have to um, fully relax to get
Gotcha.
that to expel completely. Another thing, also like going multiple times. So let's say you're active, you go out of the house multiple times a day. So there's something called like just in case peeing, and I'm sure we are all guilty of it, of course. But you know, every time you run out of the house, you don't have to go to the bathroom.
Yeah.
Like our bladder is also can be conditioned very
Mm.
easily to be like in a routine just like anything else. So if you tell yourself, "Oh, I have to go to the bathroom before I go out the door," your bladder is going to immediately, every time you think you're going to have to go outside, out or wherever, that is going
That
to have to go. I
Rovian
have to go.
response.
Yeah, exactly. So,
My
we,
wife does that all the time with
does
the kids,
she?
and she's like, "The kids have to go pee, but if we're gonna be in the car for 10 minutes, we
Oh,
have to make sure that they go to the bathroom."
yeah.
But it's actually, even starting from childhood, you could condition your kids to like get into this routine of
Yeah.
peeing at inappropriate times,
Yeah,
and
definitely.
it's actually kind of could possibly set them back.
Yeah.
Yeah.
Absolutely. And that goes back to us talking about like our moms, after pregnancy, talking about how they leak urine and that, it's normal. But the
Yeah.
same thing is like conditioning ourselves to these habits.
Mhm.
And it takes some time to break it, but it's possible to be able to just recondition our bladder
Mhm.
to be able to expand to its full extent. Which brings me to another idea. We've also probably heard that, oh, my bladder's so small, like I have to pee constantly.
Yeah.
Like, how many times have we heard that? Like, it's your bladder's not small. Like anatomically, like chances are you don't have a smaller bladder than
Yeah.
the next person. So, but again, if we have habitually tell our bladder, like, okay, we have to go empty before we
Mhm.
go into the car, or we have to go before, whatever, wherever it is,
Mhm.
whatever it is. And um, it's conditioned to those things. So,
Mhm.
like, we are telling ourselves we can't fully stretch our bladder, So, it's not necessarily so much to do with the pelvic floor lengthening or contracting in that sense, but also there's different habits that we have created that are causing these symptoms
Yeah.
and urgencies and stuff like
Yeah.
that. So
And people will like dehydrate themselves because they feel
yeah.
like I don't want to be peeing all day because whenever I drink water I have to go pee.
Yeah.
Um, but I mean, if you are actually urinating less because you're drinking less water, chances are you're probably dehydrated. And if you are urinating constantly because you're drinking a little bit more water, that's probably sign one that you were chronically dehydrated. So your body is processing and filtering that water too quickly. One thing, if you're starting to hydrate, and we're talking about like people coming out of the COVID caves and like starting to be more active,
Yeah.
if you're starting to hydrate and you find that you're consuming more water but having to pee a lot, might not be a pelvic floor issue, but it could just be that your body has to adjust to more fluids. That will get better over a certain amount of time
Mhm.
once your body kind of starts to absorb some more of that water and is conditioned to being able to consume that much water. Um, as a non sequitur, but at the
Yeah.
same time, you don't want secondary issues of dehydration because of a pelvic floor issue, right?
Yeah. I mean, I think it also goes into like, yeah, we need to have fluids to help expel our bowels
Mhm.
too. So if we are not drinking enough fluids, then are we constipated?
Yeah.
Like it's also dehydration, constipation go hand in hand in that. So, you know, are you like setting yourself up for more issues and kind of that chronic cycle? And exactly what Dr. Dave is saying, that if it's just as simple as like, oh, you're just started to increase your hydration, there's also listening to your body. And we have what's called like two like urges. So our first urge to go to the bathroom, usually we can kind of wait a little bit and wait till the second urge to go to the bathroom. So that's a whole nother thing if we go into like urges to
Uh,
actually go. But if you're also like starting to increase your hydration, then, maybe just kind of timing out how long can you kind of wait to go to the bathroom in between, and like how many times are you going in the day? So those are
yeah.
also certain things you can kind of like look at.
Yeah. I mean, also, uh, pelvic floor issues are not just a female issue, right? So you can
Yeah.
have problems with erectile dysfunction. You could have issues in men, and the same thing with incontinence or constipation.
Yep.
Um,
Mhm.
and pain during intercourse,
Yep.
male or female. And all those things are things that we might not be talking about on an everyday basis. But I mean, you should definitely be talking about with your healthcare professional. I mean, if you're seeing a physical therapist, if you're seeing a doctor, those are definitely things that you should be mentioning.
Absolutely.
And when it comes to pelvic floor PT and physical therapy, a lot of people don't even know that that's a thing. They, they go to the OB, they, and they go to the gynecologist, and males don't even, they might go to the urologist, but even a lot of healthcare providers, a lot of medical doctors don't even understand or know about pelvic floor physical therapy and the
Yeah.
benefits of it. So, could you talk a little bit about like what pelvic floor PT is? Like, what are we assessing? What are we looking at? What are we looking for?
Yeah, definitely. So I think you bring up a great point too, because like you said, I think males are also, not everyone, but a lot of times are less likely to bring up these issues they may be having. So again, trying to normalize like us having these conversations, and you don't necessarily need to see a specialized pelvic floor therapist to be having these conversations, because as physical therapists, we all can have these conversations. And
As uncomfortable as they might.
I know, trying to break through the uncomfortableness. But so I would say that essentially we start from, what does your day look like, and just going through your habits and just figuring out, what your symptoms are, and like just breaking it down. It doesn't always, I think also there's a little misconception that you think pelvic floor therapists that you have to do an internal exam, and
Some people
that,
just don't want to do
and
that.
absolutely, and that's not what it is. We don't have to do that. That's also going to come down to what your symptoms are, what's going on, and how comfortable you are with something, as such, and just kind of just breaking it down,
As
and
such.
as such, yes. So breaking it down and figuring out, can we just change a few of your habits or
Mhm.
lifestyle changes, and different things that you're doing daily that can just make a huge difference that you don't even realize.
Yeah.
So a lot
Talking
of it.
about position and
Yep.
breathing and all these
Exactly.
pressure management,
Hmm.
stress management, and the same thing goes with
Yeah.
physical therapy in terms of, say you have a rotator cuff issue or low back pain. A lot of it just comes down to habits, right?
Definitely.
A lot of it
Yeah.
comes down to like, what does your daily life look like? Are you
Hmm.
sitting for 12 hours a day in front of a computer? Like, it's probably why your back hurts, right?
Yeah. Yeah.
Are you 50 pounds overweight and you haven't lifted a weight in your entire life? Probably why you're having you feel like weak. Same thing with pelvic floor. A lot of it's just educating. A lot of it is
Yeah.
understanding and getting the depth and breadth of what someone's kind of daily life looks like.
Yep.
I can't tell you how many times in my career I've had a patient come in and be like, I have no idea why this hurts. And then we go through, pretty lengthy interview and conversation, and it turns out like they do this one thing
Hmm.
every single day for the past 25 years. And I'm like, that is probably not good for you in the long run. Um, so even if like Dr. Alyssa said, you think pelvic floor PT is like invasive and uncomfortable, and it is you're going to be poked and prodded. It's really not that. A
Hmm.
lot of it is just going to be talking and understanding where you're at,
Hmm.
and there might be some poking and prodding, but it's going to be if it's needed. It's not going to be if it's not needed,
Right.
and it's always going to be to your comfort level.
Yeah.
Um, and having the truth spoken to you is might be difficult, but there might be some life changes that you could make, and even some small life changes that you can make in your life that will make a huge difference in terms of your overall health and your ability to lead an active and healthy lifestyle.
Yeah, I think you put it very well, and that's what it always comes down to. Just we start every evaluation with a conversation, whether it's you're coming in for pelvic floor dysfunction or you're coming in with shoulder pain. It's always, about the individual. So figuring out what you're doing, what your life is like, and different ways that we can look at it from an outside perspective and just give you that education and insight to say what is right and what is not.
Yeah.
So
Yeah. I mean, one of the things that we harp upon here is like getting to the root cause of your issue, right?
yeah,
Um, and a lot of physical ailments and pain and stiffness and things of that nature, it shouldn't just happen out of nowhere, right? You shouldn't have, pelvic floor issues out of nowhere. You shouldn't have incontinence out of nowhere.
right,
And really understanding and be able to tease out and separate like what is a symptom and what is a cause, and how do we address the cause, to get to the symptom rather than kind of just treating the symptom. So I mean that's one of the main things that we really focus on here at Next Level
definitely.
is what is the root cause of your issue. If we're not, if someone hasn't addressed the root cause of your issue and you continue to have the same problem, maybe it's because we're missing something, or you've been missing something. So same thing goes with pelvic floor. Same thing goes with shoulder pain or low
Yeah,
back pain.
yeah,
And you have to find a provider that is going to listen to you, going to investigate, and really kind of dig down into what's going on in terms of your personal health journey and your body.
absolutely. Yeah,
Awesome.
definitely.
Cool. So that's it for today. Thank you so much for your time, Dr.
Of
Alyssa.
course, of
We're
course.
going to probably do some more content in terms of pelvic floor and the importance of it to your overall health. So thanks for tuning in, and we'll see you next time.